Verizon Telehealth collaboration services, utilizing high-definition video conferencing units and IP-based networking, enables a psychiatrist at the David Lawrence Center in Naples, Florida, to conduct a live, HIPAA-compliant telepsychiatry visit with a patient 45 miles away in Immokalee. The psychiatrist's high-resolution screen provides a full or split-screen view of the patient, while in Immokalee, the patient's unit is a similar, crystal-clear view of the psychiatrist.
Well, we started this whole process about 5 years ago. We've been working on trying to get telepsychiatry and telehealth to the communities, especially the very rural communities, because of access need. We know that we have a very great shortage of specialists, especially psychiatry, especially child psychiatry, in several parts of the state. And what we wanted to do is to bring telepsychiatry, because it has been done obviously in other states very well. It's actually been done for years in Colorado, which is one of our contracts as well, and it works very well for them out there. So we joint ventured with Verizon, and we got the technology piece put together, and that's really what it took. And then we waited for the Agency for Healthcare Administration to come up with the codes so we could actually do it. We chose David Lawrence Center because they have their main site down in Naples, and then they have the rural site in Immokalee, and that's one of those areas sitting on the edge of the Everglades and without public transportation, and there's a great problem with access. We chose them as a partner because they're a good partner otherwise, and we knew that they could carry this off. And we wanted to do two things. We wanted to establish having the doc at David Lawrence Center in Naples and seeing folks in Immokalee at their center in Immokalee, at their office. We also wanted the other scenario, which was to have a case manager taking a laptop room and be able to hook up to have med management visits or assessments done in the home, at the school, and various locations wherever we could do that. And we went ahead and we thought that by bringing folks into Immokalee, that would be a great first step if we could carry this off. And what we wanted to do is have case managers work with folks, help them get used to the technology, and we were all concerned about the docs, because you know how docs are, they don't want to change. And we were concerned about the members because, you know, you're not really seeing the doc, you're seeing a picture of the doc. And so we'll let the David Lawrence folks down in Naples tell us what happened from that point.
Okay, well first if we could just give you a description of the setting. Immokalee, as Dr. Moore said, is a rural area. It's approximately 35 miles from David Lawrence Center main campus here in Naples. And there is a bus that is a public transportation, but it's limited service, you know, scheduling. So it's very limited access between Immokalee and Naples for the residents of Immokalee. Immokalee is a very poor community, mostly migrants and minorities. Approximately 85% was the last statistics. So there's a lot of financial barriers to accessing anything outside their immediate town. So anyway, the psychiatrist was coming out to Naples to provide medication, coming out to Immokalee to provide medication management about 1.5 times a month. And we'd been doing that for several years. But now with telepsychiatry, we're able to provide medication management daily, or Monday through Thursday, because the office is closed on Fridays in Immokalee, because through telepsychiatry we can access the doctors that are here in Naples. So that has been a wonderful benefit. So clients can be seen on an urgent basis, or we can just increase, and even routine clients can be seen more frequently. We are providing the medication management by the doctor and ARNP. We are providing individual therapy. We're providing clinical assessments, and we're providing targeted case management. So we're basically providing all the services, the essential services through telepsychiatry that we can. We are, as you have asked, ValueOptions, we complete a customer survey on after every session or after every service, and out of all the surveys, which we've had about 82, I believe, there were only 2 that expressed that they had any opposition to telepsychiatry. Overwhelmingly, the clients like it. They feel there's no barriers. They feel that the appointments are more timely. They have increased access. And Henry can tell you a quick story about a client the other day that is reflective of this. Do you want to talk about that?
I think what Jerry has said is significant because it has allowed these clients who often could be on the edge of decompensating and can quickly access a psychiatric med management appointment versus, the initiation of the Baker Act, or, having to transport that client, 35 miles to the center for a med management appointment. I have one client who often reminds me that, and she often will say, I can see the doctor, right, Henry? I can see the doctor through the television if I need to. And I say, of course you can. And so, some of our clients are already getting used to the concept of, utilizing telepsychiatry. It's for me, it has made my job extremely easy. I don't have to transport these clients, the length of time and mileage that it takes, to get to the main campus in Naples. It's quickly, setting up the equipment, calling the office, the doctors at the other end. Often is a case of, just adjusting medication dosage, and everybody's happy. So, it really has been a tremendous service to the community of Immokalee.
And overwhelmingly, as I said, the response has been positive, and this is for both adults, children, and the parents of the children, or the adult accompanying them to the appointment. So it's across the board. It's not just one population like kids because they're used to computers. It's the adults as well. In 2009, we served 95 FHP clients and provided 645 services from June 29th through 10/2/09 for a 14-week period. In 2010, we've served 157 clients, which is a 62% increase, and provided 1,223 services for a 90% increase over that same 14-week period. Now, this is all FHP. It's not just telepsychiatry, but obviously the telepsychiatry has increased our numbers considerably in quantity and quality.
I was just saying that over the last 8 weeks, what we're seeing is between 10 and 11 appointments that are kept. And within that, what we're seeing is, 16 to 18 appointments potentially made, and people who are calling, they're canceling, and we reschedule, and they're not just no-showing for appointments.